time usages. When you get a dental roll, you will get a sheet in the dental roll that has 50 treatments in it, and then it will also specifically say how much time per day you should be using your dental roll. When you start using dental roll care, you may only start at 3-minute intervals, and you may only start at one area of the body at a time. And then as your body heals, you can add in, if you need 2 areas to do on the dental roll, you can eventually do them simultaneously. But when you begin it, your body might be stiff and not used to being in that posture, and it can actually make you a little uncomfortable. So we never want you to stay very long on the dental roll. We don't want you to fall asleep on a dental roll. I've had patients do that and they're, oh, this thing's terrible. I never ever want you to be on a dental roll more than a few minutes at a time until you've worked your way up to its usefulness. So that being said, if you're in acute traumatic pain, you're probably not going to use your dental roll. You're going to wait until the inflammation goes down. We recommend that a patient begins chiropractic adjustment care first, and then we start adding the dental and posture rolls in a few weeks after we've gotten you out of symptoms. So your first day might be 1 minute, it might be 3 minutes. Then your second day, as you're able to acquire more time, then you'll do 4, then you'll do 5. If you're having a particularly stubborn area that your body is really, really uncomfortable with the dental roll, you may also make it to 5 minutes, get yourself up, and then revisit it after 2-3 minutes, do another 5 minutes. It's another way that you can ease your body into its spinal corrections, depending on how motivated you are. Some of my patients are very excited. They want to hurry up and get their posture corrected. We just don't want to get on the dental roll and stay in it for 20 minutes unless you know that you're able to do that without getting terribly sore. So the rule of thumb with the dental roll is go at your own pace. Do 2 to 3 minutes as your first session, and then do a minute per session above that consecutively after that. And then if you're still struggling and you really want to move up to higher times more quickly, you may like to do a session of 4 or 5 minutes in the morning and 4 or 5 minutes in the afternoon. Also, if you have taken a rest from your dental roll practice, like anything else, you may have to go back to your 3-4 minutes again. Or for me, if I've taken a break on it, haven't done it in a while, on my neck I can do about 7 to 10 minutes, no problem. But my thoracic spine, it's only 5. I got to go back to 5 and then work my way up. So you need to figure out what your numbers are. So dental roll timing is very important to the success of your corrections. And if you are willing to take the time and be patient, your body will respond great to it. I'm Dr. Amy Bend, and give me a call if you have any questions. Thanks.